can Suboxone be prescribed via telemedicine? Each patient has different circumstances, and Suboxone has become a popular choice for opioid addiction treatment. With the thousands of people struggling with opioid addiction in the United States, it's essential to have access to treatment options that are convenient, discreet, and effective. With the emergence of telehealth services, it is now possible for people to receive Suboxone treatment in the comfort and privacy of their homes through a virtual appointment with a qualified healthcare provider. But not many people are aware of this. So many are still missing out on this life-saving treatment. Addiction should not be compromised by inconvenience. And with telemedicine Suboxone treatment, patients can finally get the treatment they deserve without worrying about travel and expense. This video will discuss how telemedicine can make it easier for patients to stay on track with their recovery. Suboxone is an opioid-based medication used to treat opioid addiction. It works by blocking the receptors in the brain and reducing cravings while preventing symptoms of opiate withdrawal. Suboxone is a powerful tool in combating addiction, but it must be taken as prescribed and under close medical supervision. It combines buprenorphine, an opioid partial agonist, and naloxone, an opioid antagonist. Buprenorphine is a medication that binds to the opioid receptors in the brain and reduces cravings and withdrawal symptoms, providing some pain relief. Naloxone prevents medication misuse by blocking the effects of other opioids and is used to reverse an opioid overdose in case of an emergency. Suboxone is usually taken in tablet form, but can also be administered as a sublingual film. It is typically prescribed for long-term use and should be taken as directed by a doctor or healthcare provider. It will still depend on the individual's needs and circumstances regarding how long they should continue taking Suboxone. Medication-assisted treatment, or MAT, is a comprehensive form of addiction therapy that combines medications with counseling and behavioral therapy. This approach has been effective in treating opioid addiction since it reduces the risk of relapse and improves a patient's chances for long-term recovery. Suboxone is one medication used in MAT programs. It reduces cravings and prevents withdrawal symptoms while helping people stay engaged in therapy. Suboxone is typically taken daily. It is an integral part of the treatment plan, but not a cure-all. Counseling and behavioral therapy are critical components to successful MAT programs and should be taken in conjunction with Suboxone. Sometimes logistical and financial challenges can prevent someone from accessing addiction treatment in person. That's where TeleMAT comes in. Telemedicine, or telehealth, is a form of medical care that uses technology to provide remote doctor-patient consultations. This service is beneficial for people unable to access an in-person MAT program for various reasons. Patients can connect with their doctor over a video call or through a secure messaging platform, and many providers offer this service. The process is similar to an in-person visit. Patients can receive a prescription for Suboxone from certified doctors if deemed necessary. Telemedicine is convenient and cost-effective, making it an attractive option for people in need of opioid addiction treatment. However, it does not mean the quality of care is compromised. Telemedicine providers offer the same level of care as any in-person MAT program, and patients can still get the help they need to break free from opioid addiction. There are many positive aspects to TeleMAT which make it an attractive option for those seeking treatment. Suboxone is a powerful tool in treating opioid addiction, and when combined with counseling and behavioral therapy, it can provide lasting recovery. TeleMAT allows patients to access these treatments remotely, making it easier for them to stay on track with their recovery journey. Yes, telemedicine providers can prescribe Suboxone to patients who need it as part of their MAT program. Doctors must meet specific requirements to prescribe Suboxone, including a Special Drug Enforcement Administration DEA certification. They must also be trained in addiction medicine and have an established treatment plan for each patient before prescribing the medication. Telemedicine providers must also meet these requirements and be able to provide quality medical care, just like any other MAT program. It includes regular follow-ups with a doctor and access to counseling and behavioral therapy if necessary. Patients should always consult with their doctor about the risks and benefits of taking Suboxone and their individual needs and circumstances for how long they should continue taking Suboxone. It's no doubt that telemedicine has changed the way we access medical care. By eliminating the need for an in-person visit, telehealth can be a viable option for those unable to access traditional MAT programs due to logistical or financial constraints. Here are some of the benefits that telemedicine can provide in addiction care. Many patients often can't make it to their chosen Suboxone clinic due to lack of transportation, distance, or other factors. Telemedicine eliminates this barrier and allows patients to connect easily with their doctors from wherever they are. It is excellent for those who do not have access to a car or reliable public transportation. Telemedicine doesn't just make things easier for the patient. It also makes things easier for doctors. With telehealth, doctors can track the patient's progress remotely and closely monitor the patient's recovery. It helps ensure that the patient gets the help they need and stays on track with their treatment plan. Support is vital in recovery, and telemedicine can help with that. Patients can use video conferencing to connect with their peers, family members, and support groups, creating a powerful connection even when they cannot physically be together. As you can see, telemedicine can provide a convenient and cost-effective way to access MAT programs and treatment for opioid addiction. Though it may not be the right choice for everyone, it's worth looking into if you or someone you know is struggling with addiction. Before signing up for any telemedicine program, it is essential to research the provider thoroughly. Make sure that they are certified and have a good reputation. It's also crucial to ask questions about their services, fees, and policies if you're unsatisfied with the care you receive. Additionally, always read and understand the terms and conditions before signing up. Telemedicine is a great way to access MAT programs and treatments for opioid addiction. Still, it's essential to research potential providers thoroughly and be aware of your rights as a patient. With the right provider and proper education on the risks and benefits of Suboxone, telehealth can be an invaluable resource for those seeking treatment. It's hard to find a trustworthy provider and make the right decisions regarding opioid addiction. SuboxoneDoctor.com is here to help. We are a trusted online provider connecting you with licensed doctors and medical professionals specializing in MAT programs for opioid addiction. With our easy-to-use platform, you can access quality care from providers who understand the risks and benefits of Suboxone and provide personalized treatment plans tailored to your individual needs. So don't wait another minute. Start your journey towards a healthier life today with SuboxoneDoctor.com.